If you are seriously ill but not with coronavirus, officials and hospitals across the state are warning people not to ignore the symptoms of a stroke or heart attack or other serious illnesses and to head to the hospital if they need care. WBZ's Louisa Moller has the story.
We want to talk to you about medical emergencies.
That's how a new public service announcement from several Boston hospitals kicks off with a plea to the public. Come to the emergency department if you need help.
The kind that would result in a visit to the ED before the coronavirus hit.
The kind that would start with chest pain and sweating.
Or with difficulty speaking and drooping of the face.
Why? Doctors say ever since the flood of information on the coronavirus, they've seen a dramatic decrease in stroke, heart attack, and other patients, the folks who would normally fill up EDs.
Myself, my center, and a number of others in Boston estimated a reduction of about 25%, in some cases as much as 50%. And a lot of times they sat on their symptoms and just hoped that it would get better because they were afraid to come to the hospital.
Dr. Lester Lung, director of the Comprehensive Stroke Center at Tufts Medical, says those patients that do come are waiting until their symptoms are too serious.
A number of our patients were arriving 4 days later or a week later after the onset of their symptoms, which is far too late. And every minute that passes for a stroke, there's more and more damage to the brain.
Doctors fear there could be a dangerous sub-epidemic of people suffering at home. So Lung says if you're sick, call 911. There is room at area hospitals.
We have separate floors, separate units to take care of people who do not have coronavirus.
We assure you hospitals are doing everything possible to keep emergency departments clean and safe.
Louisa Moller, WBZ News.